Good afternoon, everyone, and welcome to We the People, by the people, for all the people. For those who might be new here, we are a family-led, family-driven advocacy effort that brings parents, caregivers, self-advocates, and providers together from every corner of Florida to share our experiences and work alongside legislators towards better supports for individuals with developmental disabilities. But before I get started, I want to remind everyone that this meeting is recorded. Our families aren't always able to be here Friday at 3 o'clock, so we put this information on our YouTube channel, and we will put that link in the chat for you if you aren't on our YouTube channel. We do have a tight schedule today because we have two legislators joining us. First up, we're going to have Senator Gayle Harrell, followed by Representative Meg Weinberger. So so that we stay on track. We will make sure that both speakers have time to speak and answer a few questions. If you do have a question for either legislator, please type it into the chat, and Amanda is going to be monitoring the chat and will go through those during our Q&A portions of today. We are continuing to build momentum for the 2026 legislative session, and we are incredibly honored to have Senator Gayle Harrell here today with us. Senator Harrell has been a long-time champion for healthcare and for people with developmental disabilities in Florida. Her leadership has made a real difference in ensuring that families and individuals with developmental disabilities have a real voice in the process. So I want to thank you, Senator Harrell, for coming to meet with our group today. We are so grateful for your continued partnership and your commitment to our community. We'd like you to just take the floor and run with it.
Well, first of all, I want to say thank you for this amazing opportunity. I so appreciate the opportunity to really speak directly to families, especially, and that support team that works so closely, so hard to help their family members who have various disabilities. I've been very involved in this community, as you know, for many, many years. I have an adopted granddaughter with some disabilities, some special disabilities. And I also have been a long-term member of our disabilities community. I served on the board of directors of Helping People Succeed back when it was Tri-County Rehab Center, Tri-County Tech, a whole variety of names. And this goes back to the 70s. So I've been involved in this issue many, many, many years. And my heart is there. And I work very closely with our agency, with APD, with many directors, everybody, from Barbara to Taylor Hatch to now our new director, Bob Asztalos. And I'm delighted he is going to be there. I know him well from his days at the Healthcare Association, dealing with nursing homes and assisted living facilities, and also with Veterans Affairs. He was Deputy Director of Veterans Affairs. So I know him very, very well. I'm sure he's going to bring great enthusiasm to the department, and also maybe some innovation. And as we move forward, making sure that we get the services out there. I've seen so many changes over the years, everything from way, way, way back when the department was under HRS, all the way to the Agency for Persons with Disabilities. I've worked closely with them, first on the volunteer side as a board director for an agency that evolved over time, and then also as a legislator. So I was very involved also in helping to craft the legislation for the new pilot program that has now gone statewide for managed care. And we want to make sure that that program works and it gets the services to the people. So when it was first brought to me, we kind of did a little rewrite on it, and to really try and make sure that it was out there to serve people. And my goal is to make sure that services are available to everyone who needs them. So I work very closely with our local community. As I said, I've been a board director, president actually of the local board for several different years. But I want to make sure services are out there. So, and I'm there really to listen to you, the family members especially, and to the care council and a whole variety of people who want to work to make services there for people who need them. And, but also we have to do it within a budget. We all work on budgets. So that's part of the responsibility as a legislator, is to make sure that we are doing this effectively and responsibly within the money that we do have to do it. So I look forward to hearing from you and mostly listening. I'm not here to talk, I'm here to listen. So I want to hear what everyone has to say today. But thank you for having me.
Senators,
I am totally
thank
delighted.
you so much. Thank you for joining us. I'm Tom Nurse. I helped found this organization with Stephanie and others, and we are so grateful for your not only your media engagement, but your years and years and years of recognition of this community. A couple of specific thoughts we'd like to get from you is you've seen over the last several years a pretty significant legislative presence by families really advocating for the importance of APD, bringing stories to the table, appearing at committees. And I know that there's been an increased awareness of some of the both needs and opportunities with an APD. I get a sense that there is a legislative almost frustration with we've been spending money, sending money to the agency, and it keeps coming back unused. Can you speak a little bit to kind of maybe the role legislatively in that accountability of implementation?
Yes, certainly as chairman of the Health and Human Services Appropriations Committee several years ago. I'm not chair now, but several years ago, that was one of the things we really wanted to make sure that the dollars were getting there. And during that time frame, that was a little bit of the impetus to to really try a new pilot program with managed care as another alternative to make sure that the money was getting out there. And that had to be carefully crafted to make sure that the services came with those dollars. We don't want dollars to go out and not have services for people that they really need. So we looked at this very, very carefully. And I don't like to have to reappropriate money on the back of the bill. And we want to make sure that we look at that, the priority list, the wait list. I don't like to call it a wait list, but the categories that are there, and making sure that those in crisis get those services in as quickly and rapidly as possible. Get those budgets out there and make sure that that money is going directly into services for those individuals. I think that's one of the missions we are looking at very carefully. I think this year was better than last year. And I'm seeing some improvement. I am absolutely seeing some improvement, but we are watching it very carefully. We want the dollars out there.
And specifically, when we look at the new kind of increased annual or ongoing legislative reporting back on status of wait lists or the pre-enrollments, whatever you want to call it, an area that I have a specific interest in is the impact on infants and children transitioning early into the Medicaid waiver by waiving the family income and counting that child as a family of one. That was a cornerstone of the foundation of the waiver in its inception. And currently it makes up almost half of the wait list. So that really engages the role of the Agency for Healthcare Administration or managed care companies and APD in a collaboration. And I get a sense that there's a real eagerness to deal with the pre-enrollment list and really make a significant impact. So can you speak on that legislative engagement in that multi-agency coordination between those children that would be served under ACA primarily, with APD offering the waiver of income, respite, and support coordination?
I think that coordination with ACA is absolutely key. It's extremely important that happen. And of course, with Director Harris, the director going over to DCF, that's going to help from APD. Having that movement will help, and also having the new Secretary of ACA there, who's very familiar with DCF. So you're seeing some more coordination between agencies in order to make sure that we have that synergy between them. And certainly those early services, when children are under Medicaid, we want to make sure that they get what they need, either through our school system within the school districts, but also through ACA. We're now seeing, I think, some better coordination with Taylor Hatch going from APD to DCF, and also Secretary Harris going from DCF to ACA. We now have some coordination and more synergy going on. So as this, over this next year, I anticipate that will be easier to do. We also this year, or several years ago, I passed some legislation for medically fragile children that set the precedent, that continued this family of one, to allow the family's income to be separate from the individual's income for children with disabilities, with medically fragile children. So we still haven't gotten that waiver yet from the federal government, but we're working on that as well. So this is going to assist.
I have a
So
question.
do you know, go ahead.
I'm going to interrupt the train here. We are actually having APD Director Bob Asztalos on our call next Friday, and I've had a couple conversations with him. He has a big heart is what I've gotten so far, and he's kind of laid out his vision for this year, what he really wants to tackle. And I wanted to talk going forward into this legislative session, what type of support for this community do you see happening? Ways, I did see one bill that you had out there on the autism designation, and I was wondering if you could just touch on what you would like to see happen this upcoming session.
Yes, well, of course, I've been very involved in the autism arena over the many, many years. I work very closely with our Hope School for Autism here in Martin County, as well as the AIDS Center, the L Center for Autism down in Palm Beach County. So this is a community I'm very, very involved in. And I think we're actually starting to see some movement in that arena. And I think last year, when we were able to make sure we got those early services, we extended the age for early steps from 3 to 4. We're making those services available in the home for the family. You don't have to go through the school district. You can now get those. Again, we're waiting for a federal waiver. So hopefully that comes through this very, very quickly. That's been in the mill now, and I'm looking forward to getting that waiver. So that will be very, very important. And we're continuing that work this year in autism. And I think we're making a lot of progress. We also put $10 million into a center, a neurodevelopment center at the University of Florida, so that we can offer programs for kids, summer school, especially summer camps for kids with autism. I think that will help tremendously. I mean, that's a real problem during the summertime when school is closed, and you want something there for your kids. So having very specific camps, daycare for kids with autism will be very, very helpful for parents. So that's a pilot program out there. We want more people to get involved and start these summer programs for kids. And I think research is key in the area of autism. So we want to take all our card centers and bring all that research together from the 7 card centers we have around the state, and through the University of Florida. And I have to say, go Gators while I'm there, that we have that coordination of research, and that we really start to develop the whole research mechanism and pulling things together and really come up with, not with causes for autism, but also for what works and what doesn't work. ABA therapy, a whole variety of things that will help make sure we're getting those services, again, very early into the home for kids with autism. So this is a focus of mine. I also, another thing I have a bill out there, I don't know if you've seen it. It is on making sure parents, if you need to get special services in the schools, that you can get that immediately. We're trying to make that happen as quickly as possible.
No, I didn't see that. Can you tell me more? Because that sounds great.
Well, I have to look up the bill number. I will get you the bill number. I don't know it off, but getting an IEP can be very difficult. Those parents who've been through the IEP endeavor, getting those kinds of disability services, and especially for kids that perhaps maybe are not below the IQ level where they would qualify for DD services, but perhaps a little above that, where they would be getting disability services more in their schools through various programs. Getting an IEP can be very frustrating, more on the learning disability side. So we want to, it can take 16 weeks. You have to fail first, a whole variety of things. So we have a bill out there to address that.
That's
Keep parents
exciting.
informed.
Yes,
Make
Senator
sure-
Pasadomo is my local my senator, and we've been talking a lot. We have a school, a charter school for kids with autism in Collier, and um, I wasn't planning on this. I gotta work my words, but Florida changed the rules in 2021 to designate students that have an IQ of 67 or below are in a specialized classroom, and if you have an IQ of 68 and above, you are in the general education setting. And we have found so many teachers, so many families, there's students in the gap there that may want to be in that specialized classroom. And so I'm hoping, since you introduced that in a little bit a part of your bill, maybe we could talk together with Senator Pasadomo to see if that's something we can work on. It used to be it was an IEP team decision,
Yeah.
and now it's one data point. It's an IQ of 67, and our kids, they've got splinter cells. Like they've got great mathematical sets of skills, and then language drops, and those IQ tests are really hard to measure. So just
Mhm.
having that one data point can create a lot of gaps, and it has. And this is not just Stephanie's isolated few kids here. I mean, this is a statewide solution need. So simmer on that, I guess.
I will,
Can
we'll
I?
have the conversations on that. I also want to say on my autism bill, we want to make sure that when you are in a classroom with students with it, 50% of those students are somewhere on the spectrum, then you have to have a teacher who has an endorsement in autism.
And
So
is that through that autism bill last year that we did, that you guys did? Is that the
that was
same?
not in that last
No,
year.
that's just the autism endorsement.
Yeah, you have to have the autism endorsement if you have 50% of your students in your classroom somewhere on the spectrum.
Anna,
Bill 206.
So I
Anna
have
had
two
questions
things.
on that, so I see your hand raised, and she just opened your door, and you go.
Okay, so hi, Senator Harrell. My name is Anna Meaches, and I apologize to you. I am in my car doing kid pickup, so bear with me. But it is very lovely to meet you in person, and I've been very grateful for everything you've done. I've been watching closely, so thank you. I had a few things I want to add. So I'm in Northeast Florida. I'm in the St. Augustine areas where I live, and my kids go to school. I am advocacy for the Arc of the St. John's, and I'm also currently acting as admin at our free public charter preschool, which has existed at the Arc of the St. John since 1986.
Wow.
My son was a student there as well. So it's something that is very special to my heart and somewhere I'd love to invite you to visit, because I think a lot of what you are looking to do, I can show you how it's already happening somewhere as a model. And then you can take that and make it even better.
I love it.
But a few things that I wanted to mention. So first, you mentioned the bill, which we actually had a meeting. We were chatting about that. I love the intent of that bill for the 50% with autism with the credential. However, I had a few things I wanted to bring up. And one of the things I know from being in the school district, a big reason that teachers don't go for that credential is they can't afford it. And
Okay, got that covered.
that's a big problem. And then the other side, I worry about, because we're having such a hard time staffing ESE, and
Yeah.
it is, there's no incentives out there to be an ESE teacher. And I can tell you, even when you love this and you get to see a miracle every day, it is a very difficult job, especially when you are having to go in and create a different plan for every single child in your class, because each one requires and deserves an individual plan, right? An individual way of being taught so that they can actually learn. It is tough. I worry that this might put pressure on schools to not use ASD as the primary exceptionality on IEPs. And so that is definitely a concern and something maybe to think about as you guys are working on final drafts for that.
Mhm.
What I unfortunately see a lot is when really well thought out, meaningful measures go into place, oftentimes because districts have lost so much funding and they are up against many different things and staffing's difficult, they end up, instead of focusing on actually implementing quality services, they end up having to focus on compliance and how do we just get by and get around compliance, and that pulls from services. So it's just a balancing act, I think, and something to just have in the back of your mind as we move forward with that. The other thing I wanted to talk about, your bill from last year concerning early steps. So my son went through early steps, of course, and then I have early steps in my office twice a week. We house early steps in Northeast Florida for every single eval that happens in St. Johns County School District, and around surrounding counties even. Early steps, because of difficulty in finding providers that are working with early steps right now, difficulty in even having coordinators, and then a lack of funding. What you're offered with early steps typically is an infant toddler developmental specialist who comes to your house for 1 hour a week during the period of time that you have access to early steps. And I unfortunately get a lot of these families after the fact. I have one currently right now. As soon as she turned 3 and was able to get an IEP, she started with us. She unfortunately didn't have access to services other than an ITDS through early steps for the majority of her young life. She has vision impairment, she has mobility impairment, she has difficulty with language, she needs occupational therapy, all these things. Early steps can't accommodate all of their needs. And the school district, even when you want to do the best you can, you still have educational relevance to factor in. So the therapies have to meet educational relevance, and you have a lack of therapists as well. So oftentimes kids in the school districts, they're getting maybe 5 minutes of individualized attention in a therapy session a couple times a week in a
Now,
small
was she
group.
on Medicaid? Was she on Medicaid? These services are available through Medicaid. I lost you. Can't hear you.
Apologize. Can you hear me now?
Yeah.
So she wasn't on Medicaid, and because
That's
her
the
family
issue.
doesn't qualify. And that I can tell you from my own experience, Medicaid, especially CMS, is the only plan available in Florida that really covers all of our needs. And then you're very familiar, I'm sure, with autism laws related to private insurance. So if you don't have private insurance through an employer who has more than 50 employees, your insurance doesn't have to cover any autism services. And even with that, oftentimes families can't afford the copays and the out-of-pocket costs. So for example, my husband's a lieutenant with the St. Johns County Fire Department. Our out-of-pocket costs could be to the tune of $18,000 every year.
Anna,
Yes.
we're out of time. Do you
Oh,
have
sorry.
a,
Yes.
a target question?
Yes. So my question, when we're looking at the bill with early steps, how are we going to work around the funding factor and
Okay,
the
that's the question.
enable them to actually get those services? Yeah.
You know, that is something
Senator?
I'll have to look into. I can't answer off the top of my head. You know, I will have to do some research on that, but I'm happy to do that. Absolutely.
We'll follow up on that. Thank you so much, Anna. Appreciate your passion. Senator, you are a wealth of information and also a great contact. We appreciate any offers of guidance towards how we can be impactful in our legislative processes. We have prided ourselves in continuing to educate, to tell the truth, to be at the delegation meetings, and the support from folks like you means the world to us, and we thank you so
Thank
much.
you. Thank you. And I am, my door is always open. Absolutely, always open to you all. Appreciate you
Thank
very,
you.
very much. Thank you.
Thank
for
you
having.
so much for spending this half hour. If you don't mind, we did have one more question, and then we know you've got meetings. We want to let you go. I see Nicole, are you off mute?
I'm off mute. I'm sorry. I don't want to take too much of your time. I just wanted to ask because I saw that it seems to be kind of a recurring theme for you about early interventions. I really appreciate the focus that you put there in past bills, and it looks like again for this coming year. My question is, as we talk about the different avenues for agencies that assist with our families, would it be an interest for you at all to help with standardizing the legal definition of autism? As we have each agency has a different definition, and a lot of these definitions haven't been updated since the 80s.
So I will be, if you can send me specifically the different definitions in the different agencies, then I can see those. We can absolutely look at that. You know,
The reason I ask is because I drafted a bill for that this session, and Rep.
Okay,
Maggard
all
was helping me with it, and I was just kind of on the sly trying to ask, but I did talk to Director Asztalos about it as well, and he's interested. So I thought, well, if we have you here and you're interested in early intervention and having that access, then yes.
Yeah, get me something in writing.
Shameless plug.
Happy to look at it.
Excellent, thank you.
Yes, I already have.
Thank you so much.
Filed, so there's lots of ways to amend.
Thank
Great.
you. I knew what she wanted to ask. I wanted to give her that opportunity. And thank you so very much for spending all your time with us today. And we definitely will see you. Our Developmental Disability Awareness Day is February, where are we at 10th? Yeah, February 10th.
Wonderful.
So we will be in touch, and we are just so grateful for your championing for our families.
I am totally there all the time. Thank you. Appreciate you greatly.
Thank you very
Thank you so
much.
much. Thank you. Bye.
Thank you. Well, we do have Representative Weinberger on our list, and I don't see her on the meeting. So I was gonna real quick let Melissa pop in because she wanted to talk to families about family care councils while I call Rep. Weinberger and see if we can make that happen.
Great idea.
Hi, everybody. That was really nice that Senator Harrell was on. That's cool. There was legislation that was passed this year that really does, that is about the Family Care Council. And the Family Care Council, the definition, I'm sorry I didn't pull it up, but basically the purpose of the Family Care Council is to have families and, recipients on those councils, and there's 15 of them that are statewide. We have 67 counties, 15 family care councils, and there's a statewide family care council. But there's a lot of those councils around the state that have not been active, and it is made up completely of families, and it is the families' job basically that's on that council to advise APD. So I think that would be fantastic for the, families to do that. Joining those family care councils in your area, contacting people that have already been a part of it. So I'm gonna try to, I guess at some point I'll minimize this and look up the the website for like the direct,
Melissa,
it's on
I
the.
put them I put them in the chat. So both the
Oh,
Florida
good.
statute for FCC and then it's
Thank you.
fccflorida.org for those interested in looking to find their region that they fall under and contact information. Anna is from one of the busiest and one of the ones that we know about the most from her area, but the information is there in the chat for everybody.
Yeah, and if
Great.
anybody's
Thank you.
interested in starting theirs in their area and they want to see what it looks like, we welcome in Area 4. We meet on the third Wednesday of every month. It's online. Please feel free to join those meetings. They're public meetings. That way you can see what it's like. And then if you have questions or want help, we're here to help.
Well,
Yeah, I mean,
I just heard back
you guys
from.
are the subject
Hold
matter
on a
experts.
second.
No, it's okay. I just heard back from Meg Weinberger, and she's gonna, or I'm sorry, Representative Weinberger, and she's gonna be on the call in about a minute. But I wanted to make sure on this subject that everyone on the call knows that next Friday on Halloween it'll be trick or treat with APD Director Bob Asztalos. So he's gonna be on the call next week, and Director Asztalos and I spoke this week on family care councils. And he actually met with the governor's office yesterday, he told me. So he's going to have an update on applications. So if you've put your application in for appointment, he'll be coming back with updates on that. And he will be here. So if you don't know, I think I know most everyone on this call does know about family care councils. Um, I hope that you are going because we could do some big stuff. Melissa is absolutely right. Like this is key to policy going forward. And true collaboration with the agency,
Correct.
despite the director, despite the governor, despite the APD workers, this is your council. Our council
And
met.
this is the foundation of how this started in the first place, that we're just trying to get back to our roots when it comes to the engagement. And it's our whole, for the people, by the people, for all the people. This is what the process is. So understand that it's not everybody's enthusiastic about it. Feet are being dragged. It's not getting, it's not moving along. We have to continue to provide the urgency and insistence that this is part of the democratic process of engagement, not a little d, and that this is how we do it. And so it's in the legislature. We've gotten support. We got to keep speaking up. We got to make sure those appointment officers are being responsive. The applications aren't sitting on somebody's desk from
Hey,
last
Tom,
year, and we just kind of rattle the cage.
do you want to mention what's required to be a council member that's actually appointed on the council versus everyone can
Sure.
attend the meetings?
Let's post that right now because we've got Meg on the wings ready to join in, and we're going to have to shift gears here to bring her aboard. Isn't that right, Stephanie?
Yeah, but she's not here yet. Oh, wait,
Okay.
haha, wait, hang on. Here she is.
Let's do it. We'll come back.
We'll give her a second
You
for it to all load up for her.
do the intro.
I will. So Representative Meg
Hey.
Weinberger is here.
How you
Hi, girl.
doing? Sorry,
Oh.
I'm mobile.
Yeah, mobile and busy, I'm sure already.
Crazy, yeah.
Well, we are so glad you're here. I want to let you know who you're talking to. So we've got a group of family members, caregivers, self-advocates in the world of developmental disabilities. And I've talked to you about this before, but we meet here every Friday to talk about how we can connect with you all to make some positive legislation in this space. And I'll let you share. I know that you have a huge heart for us, and I know the connection. But I think that it would really help families to know who you are and what you're passionate about, and maybe things this session that you are hoping to happen in this space.
Sure, absolutely. Well, thanks for having me. Sorry I'm a little bit late. I actually just met earlier today with Marlene Sotella, the CEO of the L Center for Excellence. And to pick Marlene's brain a little bit, we've been longtime friends. I've been taking my animals to the L school for many years, which I'll get into in a minute. And yesterday I was at the Potentia School, which is another school here in our community. So just kind of tells you how I am like to stay very dialed in. It's one of my happy places, and I'm very passionate about seeing what I can do to be effective in this space. But to start, I grew up, my parents adopted two of my sisters, and one of my sisters was special needs. She was Down syndrome. Unfortunately, Weezy passed away a few years back, but so just, I know firsthand how scary it can be if something were to happen to my parents. It was a conversation we always had. And many people didn't understand a lot about the way Louise interacted, or as she got older, especially. So, and then obviously, kind of just growing up with it, it was something I've always been drawn to, bringing my animals to the communities, the schools, making sure they always have a place at my facility. Now, I don't think you even know this, but now I employ autistic individuals. Went through the whole process of, the job placement, and which was really interesting to go through. At first, I was kind of thinking, I don't really need to go through all this. I know what to expect, but it was such a learning experience just to kind of see that process. It was, and how necessary it is. And so, I did file a bill last year. Really, you guys all know the need for housing and employment. Um, and obviously we know about the wait list. So there's so much, and it's, so I love to be dialed in. I love to hear from you guys. We can only, bite one piece of apple at a time. So it's frustrating as that is for me sometimes. And I know definitely more for you guys. Um, I just want to make sure that the time that I'm here, it's going to be effective, and the people that we truly know need it the most are going to feel it. And we're going to make effective legislation that will, last and be able to be implemented and make sense. So
Thank you.
definitely utilize me.
All right. Well, you just opened it up. So, thanks for joining us. And if anybody has some questions for Representative Weinberger, you're more than welcome. I knew her before she was officially elected, and she and I share a very close friend, a mom of a child with autism. And she really gets what we walk through. And I know that she's in Tallahassee for a purpose, and part of that is to help us. So if you have questions, anything that you want to see happen in Tallahassee coming in the next couple of months, now is our time. I know I am a little concerned, honestly, on the lack of conversations, and not really knowing. I have not heard, hey, where are we on the pecking priority list this year? I know that we had a lot of attention the last couple of years, but relatively our families are in the same situation, and um, I there's a lot of noise. There's a lot of noise all the way from the federal to the state to our local areas on the special needs population. And so I'm hoping that the state of Florida sees that and they want to champion around solutions. Um, and I think, Tom, you had your hand raised.
Yeah, I think it's taking that thought to another step. And welcome, Representative Weinberg. We're glad to have you here. There is a significant shift in state responsibility in guidance and programs, particularly that serve people with special needs. The challenges with what's going to happen with Medicaid, which is a significant funder, what's happening with the Office of Special Education Programs, federal DOE, and how does IEPs and those things kind of happen. Can you speak a little bit to how you see the state's engagement in kind of taking a stronger leadership role, that some of which had been historically federally driven? How do you see that might be changing over the next few years, and what role does legislature have in that, protecting the most vulnerable citizens in our state, and shifting from such perhaps a federally mandated to a state led?
I that's something that I think that will be more palatable for all of us. I'm obviously this is going to be a learning curve for me as well. But from what I have, the conversations that I have had, it seems it's going to be a lot easier for us to be have a seat at the table when it's state run as opposed to federally run. And I think it's important for you, the fact that you guys have, this voice that you have, and the agency to go talk to. That you can go to the agency head or reach out to a representative, whereas it's not as easy to get in front of some of the people that you would really need to make lasting change in DC. You're going to talk to a lot of staff as opposed to getting in front of lawmakers. I have had some conversation on the Medicaid. I'm happy to share a one pager I just received. I really wanted the documents like from the bill because I wanted to understand it more. I will be happy to share it with you guys as well. From what it appears, Florida is not a state that's really going to be affected by any of that from the Medicaid change. It's more the states like California. And I will share this with Stephanie and she can share it with you guys so you can understand it. The way that California kind of set up, and they were taking Medicaid funds for people that are not citizens. So that it's kind of taking away that, as opposed to, you'll have to see the one pager. It's very interesting. It's not affecting states like Florida. And that came from a congressman. I actually just got the white page today because I had a lot of people commenting on it. And I said, I need to understand this more. So I'll be happy to share the white page. So that's like from the actual bill, and it was pertaining to Florida. So obviously I'm not in California, so I'm not going to be as versed in California, but I wanted to learn what was going on in Florida. So I will love to share that with you so we can all understand it more as well.
Thanks.
Yeah.
Amanda, did you had your hand?
Yeah, so with our population, we're, I guess, getting more choices as far as providing or providers and care and stuff like that. So we have the iBudget waiver, we have CDC Plus, which a lot of families love having that option. And the consumer directed care, where the parents can choose their own providers. They're not pigeonholed into, so having to deal with someone that they don't like only because their insurance pays for it.
Right.
So, and then now we have the managed care. So I am in Putnam County, and what we're seeing in my county in particular, because it is a rural county, is the lack of providers. The need is here because I part of my job, I work with the ARC of Putnam County. Part of my job is going into the school system and talking with families about the importance of applying for, the Medicaid waiver and doing it as early as possible because of the wait list. And also having gone through the crisis process for my own son, knowing that if you're on the wait list, hopefully you can move a little faster if there is a crisis. Anyway, all of that being said, we're a provider desert in Putnam County. So, managed care isn't really an option here. Is there, what are your thoughts on trying to either ramp that up or keep funds going towards, the CDC Plus and the iBudget waiver?
Okay, so
That
it's
makes
like a two. Yeah, give me. So let's start with the first one. The first is, how do you feel you could have more people in those job descriptions that you're in need,
right. And we also we're lacking in
like therapists and
support, like
Respite.
the
Someone take care of them.
respite. Yeah, there is
Work.
no respite here. People have to call outside of Putnam County and the people outside of Putnam County aren't driving all the way over here just to sit with the kids for a couple hours. But also we're lacking, waiver support coordinators. So it's there, like you said, there's so much that goes on to making sure that our folks are taken care of. I don't think there's a one size fits all solution.
You're
Right.
talking about,
But like you said, taking one bite at a time from the apple.
Right.
But there are a lot of apples.
Yes, I know. And even when, when you're, as, session, comes up and realizing what's the most important to tackle it, each, are these therapists, I mean, I think it's important to, are these therapists that are therapists or, and even in the respite, is this certificate-based programs where we could be trying to get in front of our high schools to utilize maybe kids that don't want to go to don't want to go to college, but can make a very good living. I mean, is there a way that maybe we should be going to the, um, I'm happy to talk to education chair. I mean, Jennifer Kennedy, who's going to be Rep Kennedy, she's going to be the Speaker of the House someday. She loves education. She's a teacher for 25 years. I mean, I think that we need to open up all of our minds and people that don't want to go. I mean, we all have plenty of friends that didn't go to college for 4 years or did go to college for 4 years and don't even use what they went and they still owe money. So I think to have that solution, is it a certificate based, is it something that they could do, with the therapy and maybe, you have different levels, but at least it would offer some of the counties that don't have as much, in the job pool. I mean, it's just a thought, and it's just kind of one of those things that, is this something that we could do? Throwing things out there for all of us to kind of go, could that work? Is it something that could be taught in a certificate program, maybe even starting to learn in high school? I'm a big believer we all know what we're exposed to. And if you are able to expose many of the kids in high school that have never been exposed or really know how to interact with, I love to call them angels on earth, because I'm sure my sister was an angel, that many don't. Many people do not know how to interact with our angels. So I feel like I think that there's different ways that we need to look at it. It doesn't have to be somebody that went to a 4-year college and then is expecting to make, $180,000 coming out of college. I mean, maybe it's somebody that really doesn't want to leave their town, but would be okay to gain a certificate, and that would be their life's work, and it's very rewarding. And if could it be a state, something that the state offers, or is it something that they could possibly then go into with APD? Is this something that we should talk to? You know what I mean? We have I really like who is in leading right now. I think he's only there for a year, but I had a meeting with them the last week of committee, before I left, and he's great. I mean, I think these are some things that maybe we could talk to them about. If you guys think, as you're the parents, you're the ones that live it, breathe it, is this something that could make sense and could work possibly?
Yeah, we're definitely talking to them about it. And just to give you a little more insight, because I know you run all the laws in Florida, and so this is just so much information. But I'm gonna give Nathan, because Nathan, the people that come and watch Nathan, so mom and dad can go to work, and I mean, that is high level experience with
Yeah.
a heart, and it is minimum wage.
Right.
So a lot of the provider deficits we have are because it is so much easier to go to McDonald's and flip a burger than care for these folks. And so there is, I think you're onto something there with credentialing. There's micro credentials or something to look at it to incentivize. But our provider rates are set by the state in the state budget. And Putnam County is far from the only one that has a workforce shortage. We all do. And
Right.
our population is really growing. And I think that the two known facts have to meet in the middle, and this should be the year that our president of the United States is acknowledging how many kids, what I think what he said is 1 in 10 boys. And then
Yeah.
the fact that we have no workforce to care for these families. Florida needs to be the ones to say, you know what, let's meet the match there. And that micro credential idea, I think, could really help elevate the not only just give the person who might be interested, but even like internships in high school, in
Mhm.
college,
Yeah.
to offer those opportunities, find ways to incentivize the workforce. The DD Council, I was on some work group. Alan was there. We were looking into this, and there's a group, Mathematica, I think. I don't know. I might be mixing up groups, but there's a group looking into solutions because this provider shortage is real.
Mhm.
And then, kind of going back to the managed care part of Amanda's question, we have we have two different tracks really for our folks, and the managed care got started and it got funded really well. And meanwhile, the majority of the population in that sector, there's like 35,000 of them that are getting services on the other side, and that needs support too. So
Yeah.
I'm here to say, when it comes to the floor, because I know you don't really serve on those committees, I don't think.
I'm
We
an education subcommittee, but I love how dialed in our chair is on um workforce for,
Mhm.
yeah. No, I'm not on HHS, but HHS, is that what you're talking about? HHS?
Yeah, yeah.
But definitely talk to, Chair a lot. I'm a big fan of Chair Andretti and his budget, but they're all, I mean, and Rep Tom Coach, she's fantastic. So I think these are all really good people that you guys have the opportunity, and all of us work very well together. I mean, have to say the house is very much a family. So if you bring it to me, and I have no problem, getting in front of either of those chairs, because I know they truly care. It's a really good time to do this.
Yeah, we know, I mean, we're all talking with our reps too, and
Good.
in those committees, and next year you could go to HHS, who knows? Um, so I just wanted to like kind of clarify with the provide there, the majority of the people working with our folks aren't getting a college degree. Some of them are, but the real gaps in services when we're talking our waiver support coordinators, they're the only required person to have services. You have to have a waiver support coordinator. And where we live, if somebody got accepted onto the waiver, we do not have any that do that self-directed program, which is called CDC plus. Um, and we don't have the workforce to go the traditional route. Like my boys are on the waiver, and they do CDC plus, so that I hire the people that I know, love, and trust to take care of the boys. And that has worked really well for my family. But I did that because we literally have no one in this area. And so there's an imbalance there. We really need support with that iBudget program while they build people to have the managed care. And I'm going to tell you, because I know you and I feel like it's easier with you. I don't want that option for my boys. Managed care has historically not done well with this population, and I mean very
Okay.
recently. And I've met with Florida Community Care. I think that they are going to be doing the best they can to serve the population. But I know my boys' very unique and intense needs, and that's not an appropriate option. So families really want to make sure that that stays optional, and that the other program gets the equal amount of attention as the managed care program. And we have time for one more question, and I see Sandy very patiently raising your hand. So we want to
Yeah.
let Meg hit her afternoon.
So my name is Sandy Studeville. And I just wanted, since you said you're on the education committee, I wanted to know if I could reach out to you, because I was at my delegation meeting and I haven't had a chance to get back with them. My son's kind of in a medical crisis, but I proposed regarding to the FESUA, the Family Empowerment Scholarships for Unique Abilities, an oversight board for them. And then also some of the issues regarding those that have developmental disabilities that aren't going to go on to college, and how it's now set for us to lose our funding 3 years after they turn 22 Whereas if they go to college, they can keep their funding. And that to me seems upside down. It really shouldn't apply to either, but if it is going
Where is that coming? Where is that from? What is
from
that?
the Family Empowerment Scholarship for
The
the
unique
Step Up for
abilities
students.
where the money follows the child, where you can
When
apply
you're-
for that scholarship
when you
and
apply for
use
the-
it. Mhm.
Sorry, school choice.
Uh, Sandy did an amazing job at her delegation, really
Yeah, and I can send
explaining
you a link
it.
to my
And
presentation. But I'm looking to, and Senator Mayfield was interested, and I gave her a thing of the oversight committee, and that's where it would help a lot because parents don't have a seat at the table, and we really need to be, it's like the same here. We need to have a seat at the table because we can help say, hey, you passed this law, but it's not being implemented right. Like what happened with the purchasing guide and how they met the letter of the law, but not the spirit when they couldn't agree on a guide. And then you had to put in the Center for Unique Students and Abilities. So I would love to partner with anybody on the education committee.
Sure. Yeah, absolutely. Please reach out. Stephanie can connect us for sure.
All right. Thank you so much for your time,
Yeah.
and your interest. And it's neat to hear your story and to know, it's just heartwarming to know that there's people that are in office that care and get it. And it really means a lot to know that.
Yeah.
It helps me sleep a little better at night.
When I was visiting the Potentia school the other day, it was a great school. I guess the Rooneys started it, which Tom Rooney and Pat Rooney, both, I think they've both been in politics. And so I didn't realize that the family had started this school. And one of the girls, I was talking to them about my animal sanctuary, and the principal said, well, tell them about, what you do in the Capitol and legislation. And, so I was giving them a little bit of insight, and I said, oops, did I lose you?
nope.
Sorry. Okay. I
Yes,
said,
you did.
well, let me, so I was explaining to them, about some of the animal legislation and how animals are considered property. And one of the girls, honestly, she said, I need to speak. And I said, okay, well, she said, I don't understand how animals could be considered property. And she was, really fidgeting, and she said, children are not property, and it's our job to take care of children, and it's our job to take care of animals as well. And she went on for a good 10 minutes, and I said, oh my gosh, this girl, you need to come to Tallahassee. This girl should speak in committee. So, I mean, these folks are we learn from them, I'll tell you this. So I'm happy to help any way I can.
Well,
I mean, it
I
means
just
a
want
lot
to thank
me.
you because to help people like you can help educate, because it's hard. You can't,
Yeah.
It's hard to understand if you haven't lived it, even if you want to understand.
Right. No, it's true. It's very true. I know, and I feel so fortunate that I was able to have a sister and live so, closely and understand that world, because it does, what you're exposed to. And it was very important for me, for my daughters to be completely entrenched in the world as well. My kids, if they see somebody that's different than them, they're drawn to them. They're making them feel just like, probably more comfortable than they would anybody else. But I think it's important, and it comes down to education, making sure that we're teaching others the importance of that interaction, and making sure that those people are not overlooked, that we're their voice.
And I'll tell you, Representative Weinberger has answered emails from families that I have said, hey, they're in your area, help me, at like 2 in the morning. When I say she really cares, I mean, she really cares. So I will follow up with the meeting and give you her email where you can reach out to her and talk to her as we come up. We are going to be coming to see you in February.
Yay,
So
okay, great.
we'll be there February 11th, a little bit away, but it goes by quick. And I know that you're our champion. I just want to say thank you. Thank you so much for taking the time to meet with our families. And
My pleasure.
I hope everybody has a happy Friday, that you guys
Yes,
enjoy
safe.
the weekend, and I appreciate everyone spending your hour with us.
God bless. I'll
Okay.
send you that white paper too, so you can share it with everybody, because it's very interesting.
Thank you. Thank you. Thank
All
you.
right.
Thank you.
Take care, guys. Have a good
All right.
one. God bless.
Guys, next week it's with Bob Asztalos. We have APD Director Bob Asztalos on the call. So make sure that you're here with your questions. He is very willing to talk to families. Have a good weekend.